was an absolutely fantastic meeting. ESMO 2019 has given us the opportunity to learn a lot about breast cancer studies. Outstanding trials were presented here. So if I have to select maybe 3 key points, I would select the data we knew in early triple-negative breast cancer, Keynote 522, but also in the metastatic triple-negative breast cancer, Keynote 119. And also impressive data in the ER-positive metastatic breast cancer field with the Mona Lisa overall survival data. Mona Lisa 3 is a randomized phase 3 trial, placebo control, tried to demonstrate the combination of fulvestrant plus ribociclib compared with fulvestrant plus placebo in patients with ER-positive, HER2-negative metastatic breast cancer, previously pretreated, and some patients were also treated in the first line. So the primary endpoint of this trial was progression-free survival, and we already know that patients who received the combo treatment did much greater. However, at ESMO 2019, we knew the interim analysis about overall survival. And it was very interesting to observe how those patients who received the combination of fulvestrant plus ribociclib clearly improved survival compared with those patients who did not receive ribociclib. And in brief, the hazard ratio was in the range of 0.72, which in my opinion is not only statistically significant, but also of great clinical relevance. I think it's very interesting to observe that other compounds with the same family, abemaciclib or also palbociclib, all of these 3 agents, CDK4 and 6 inhibitors, also showed great data in terms of overall survival. So I think that all these agents are here, will stay, and this is a great opportunity for our patients to prolong their lives and to live better and with the disease much better controlled. One of the most interesting studies we presented at ESMO 2019 was Keynote 522. This is a randomized phase 3 placebo-controlled study in early triple-negative breast cancer in the neoadjuvant and adjuvant setting. In brief, patients were randomized to receive an optimal chemo schedule, carboplatin, paclitaxel, followed by anthracycline-based therapy, with or without pembrolizumab, a PD-1 inhibitor, followed by surgery, and followed by pembrolizumab or placebo. This trial had 2 co-primary endpoints: pathological complete response and event-free survival. So here at ESMO, we presented the first of these co-primary endpoints, pathological complete remission. And the trial met the primary endpoint, so PCR was clearly improved from about more or less 50-51% to about 64%, which in my opinion is not only statistically significant, but also of great clinical meaningful. Also, one comment is that we present preliminary data in terms of event-free survival, mature data. We have to finish the follow-up, but at this time there was a very, very clear trend also in event-free survival with a hazard ratio in the range of 0.62, 63, 64. Based on this data, I think that pembrolizumab will become a standard of care, hopefully, in the upcoming months or years. We have to wait until the FDA, until the EMA decision based on PCR, but I'm pretty sure that this will become a standard of care at some time. Keynote 119 is a randomized, open-label, phase 3 trial which tried to compare if pembrolizumab single agent was better in terms of overall survival compared with chemotherapy. Chemotherapy was a mix between eribulin or CAPE or vinorelbine or GEM. Once again, the primary objective of this study was overall survival in triple-negative breast cancer, second or third line. So unfortunately, we did not observe an improvement in survival, so the trial was negative. However, we did a very interesting exploratory analysis regarding the expression of PD-L1, followed the CPS score, basically it's a way of measuring the PD-L1 expression, and we observed that there was a clear trend. Those patients which tumors had more expression of PD-L1 did have much more benefit from pembrolizumab. Again, it was an exploratory analysis, but maybe for the future could be interesting to see if immune checkpoint single agents without chemotherapy might have any benefit in patients with important expression of PD-L1 in pretreated patients.